But this is not about education. This is really about us taking control of our reproductive health. We live in this bubble that you get just, you see Hollywood movies. Oh, yeah, let's get pregnant and I'm getting pregnant tomorrow. It's not really. It takes on average 1 year to get pregnant, Take ownership of your fertility journey and your health. It's very important.
Welcome to the conversation. In today's episode of Trailblazers, Johnny is speaking to Sarita Stefani, co-founder of Amilis, working towards better female health. Enjoy the conversation. Be sure to subscribe and follow us on social.
Sarita, it's a pleasure to have you here.
Nice to be here. Thank you.
Tell us a little bit about yourself, your journey to where you are now.
Yeah, so I'm the founder of this company called Amilis, actually, that I co-founded with Yasmin. I'm the CEO, she's the CTO, and we're doing very great. We are actually raising a seed round now, so to expand the team and be able to expand the company nationally and offer more diagnostic and secondary care to women going through fertility treatments or in general that have been diagnosed with conditions. So yeah, it's been an interesting journey, and yeah, we're growing very, very fast, very expanding. Everything is going very well. It's a lot of work, but hey, I picked the life of the founder, so we have to go ahead with it, I guess.
Yeah. What was the inspiration behind Amilis?
Yeah, the inspiration behind Amilis is a personal journey. So I went ahead and freeze my eggs some years ago. And I found it very interesting that before even I consider egg freezing, coming from a family of all gynecologists with fertility clinic, I didn't even know if I was fertile. And I was on my 32. I was 32 years old. So, I had some vaginal scan before, and I tested, my, smear tests, I kept control of my reproductive health. But I never knew if I was pregnant, if I could be pregnant before 32 when I went ahead and did with this AMH test, which is like a very simple blood test. It takes 30 seconds, literally. So I found in the entire process quite interesting because, I consider myself an educated person, but this is not about education. This is really about us taking control of our reproductive health, or in general about controlling our journey throughout being pregnant one day, or even just understanding your fertility levels. So, I found the process necessarily difficult going through egg freezing and discovering my fertility. And I decided that we needed to do something about it. We needed to enable women to understand their fertility, or, even just test at a younger age and understand what will be the next step they need to take, if egg freezing is an option, for example, or even, from this very simple AMH test, you can catch some conditions and you will be able to prevent a lot of pain event going in the future. So, from my personal journey through freezing my eggs, I saw a lot of what we call unmet needs. And I really wanted to help women out there to empower themselves with knowledge and go through their personal journey throughout their fertility. And my co-founder has a similar story. She did not freeze her eggs yet, but she has a condition that basically, is just a way to say that she has very painful periods. Nobody knows, and nobody understands. Nobody tells her what's the next step. There's no speciality for it. It's just, our bodies are not really well studied. There's not enough research to get her to the next step.
Yeah, unfortunately, that's one of the familiar stories in kind of clinical research data and trials, and much of the work lacking in women's space around this. Why would someone consider freezing their eggs? What's the kind of things that they should consider?
Yeah, so we see a lot of women that come to Amilis and they have this at the back of their mind. Egg freezing, we have to consider that is not for everybody, right? They're throughout the process, you can get diagnosed with a condition that won't allow you to go ahead and freeze their eggs immediately, or, you know, like you just maybe not the right option for you at that stage of your life. So you have to consider that, you know, like a woman might arrive and think, okay, I really want to freeze my eggs, but maybe it's not an option for her. And nowadays doctors are very clear. The partner clinics we work with, they're very clear in this. Usually what we see from Amilis and the patients that come to us, the women that come to us, is that or they're single and they're in the mid 30s or late 30s or even early 40s. And they are sudden, you know, like as women, when we turn 30, we're like, okay, I need to get married, find an husband, I'm gonna be pregnant, I'm gonna have kids, and then I can take 6 months off from maternity or whatever it is. You know, like we do all of this. As soon as we reach 30, we have a clear plan. It's like the biological clock ticks in, and you're like, okay, step number 1, find the man, marry the man, have kids. Okay, I can take some time off. This is the right moment of my career. You know, like just we plan it properly. So we've seen that a lot of women are maybe single in the mid 30s and they decide, okay, this is an option for me to have more possibility in the future to have a kid, which, by the way, egg freezing doesn't guarantee you to have a kid.
Yeah, I was going to say, like, what are some of the other considerations that you need to think about with regards to egg freezing? Because as you say, I'm pretty sure it wouldn't guarantee necessarily. Are there also any benefits to freezing earlier as well? Obviously mentioning mid 30s. Does that come into play as well in terms of any sort of other factors?
Yeah, there are a lot of factors to egg freezing. For example, you go ahead and do this AMH test, which gives you a rough idea of where you are with your ovarian reserve. They're very, very simply explained. Then you have to go ahead and have a vaginal scan, which sees if your ovaries are okay. In some cases, maybe some women have some cyst or fibroids or other things in their ovaries, and then, you know, like they need to take a different sort of action before freezing their eggs. So that's something to consider too. Yeah. Some women may have a very low AMH, which will say that, you know, like they are perimenopausal. So here they are depend on the age. Maybe you should consider freezing an embryo. So there's with a sperm donor if you're single, or, you know, like test your options there. So there are a lot of factors to consider. Assuming, you know, like you do an AMH test and your ovarian reserve is looking good, your ovaries are looking good, and you can really go ahead and freeze your eggs, you should do it sooner rather than later, because the eggs quality is better when you're younger rather than when you are in your late 30s or early 40s. So the sooner you do it, the better it is. Obviously, egg freezing is expensive. So, I mean, when I was able to pay for the treatment, I was 32, you know, like, and, you know, like I had all the support from my gynecologist family. So, you know, like I really had an amazing experience just because of that. And still I found the process quite shitty, to be honest. But, you know, it's, women might be able to afford £6,000 on average when they are maybe in their late 30s. You know, before that, you want even prioritize other things. You buy an apartment, or, you know, like you just spend your money in.
Or you want to maybe have a bit of a life. You want to go on some holidays, and I guess this throws up a more interesting societal question in terms of the funding that goes towards things like egg freezing. Obviously, we know that there's an unspoken problem that we're facing in the West, particularly, which is declining birth rates.
Yeah.
And actually, one of the big factors that plays into that is the financial, which is, as you said, you want to develop your career to a certain point so that you can afford these things and afford to provide for a child. But there's also a challenge around health of those eggs being there earlier. So there needs to be some sort of mechanism by which we can provide women a better on-ramp for that, so that they can actually have the ability to do this. Maybe there's some sort of governmental funding, maybe there's some sort of initiative, maybe there's something that can be done to better enable women to be able to do that without sacrificing career, without sacrificing the other experiences that they would and should have.
Yeah, for sure. I mean, it's a lot of big companies now, they pay for their employees egg freezing, so this is getting better. Also, we are doing something at Amilis that will help women to pay for their treatments and, you know, like enable them to just like just afford it. And ultimately, like everybody should be able to decide this
100%.
at the earlier stage in their life rather than, later stage in their life. But things are moving, thankfully. Like there are a lot of companies out there that are doing a great job to make fertility treatments, not just egg freezing, more affordable. So, like it's yes, like unfortunately we're becoming less fertile. I think 1 in 6 couples or 1 in 7 couples suffer of infertility. And we want it or not, unfortunately, it's something that we have to address as a society.
Yeah. You mentioned that you found the process challenging.
Yeah.
What does that process currently look like?
Yeah. So assuming that you have decided that you can go ahead and freeze your eggs.
So you've done the AMH test.
You've done AMH test, you do a vaginal scan, you discuss your result with the doctor, you pick the clinic. So that the first step, number 1, is picking a clinic. And that's actually why we created Amilis, because I went to 3 clinics before I decided which one I wanted to go ahead with. And every time you step in a clinic, you spend a lot of money because you do the test, because you speak with the doctor. And I love doctors. These guys, they study 10, 15 years. So I should pay for their hour. I mean, I go pay out for a meal. Why am I not paying for 15 years of studying of this amazing human being? So I understand that, like I'm a big, big fan of doctors, of course. But of course, like then when you go to 3 clinics and you speak with 3 doctors, your bill comes up to £1,000, like every hour or test you repeat and so on. So I did spend around that just to pick a clinic.
Wow.
Yeah. So, and again, it's not really like all the clinics in London that are approved by the authority that is regulating clinics in this country, they're all good. Like there's not, it's just a feeling that you have with the doctors. Again.
Well, it's such a huge decision.
Exactly.
And you're putting your faith and trust in someone. So yeah, you have to have that right feeling when you meet that person. And unfortunately, as you say, if you're going through the process and you have to go through that process with them to even get to a point that you feel that comfort, you feel that they have your best interest or that you have that rapport with them, there comes a financial cost with that. That seems like such a massive barrier to get over for so many women.
Exactly. So that's the thing, like it's just a matter of like, I mean, again, these guys are humans. We see doctors as like ultra natural creatures that make everything right and they know everything, but they don't. They're very much human, and that you just need to feel comfortable with the doctor that is speaking with you or doing the treatment. And I can tell you that the first doctor that I spoke with, bless him, he was a very nice guy. But for me, like I was a bit slow. And it was like, it was not, like it was answering my question with like, perhaps, maybe, like I don't want perhaps or maybe. Like I want to get in, do the treatment and get out. Because, like I knew that I could, like.
I never would have guessed that.
So, like it's just a matter of like, okay, I'm like, like, and then I met the person I decided to go with was this Spanish woman, very like cool, she was like giving me the vibe. Okay, this is what you do with this AMH and with your profile, you can get this number of eggs. Are you ready? Okay, yes, I'm ready. Like it was just a feeling, just a feeling. And then I decided to go ahead with her. But point is, like, you have to pick the doctor that you feel comfortable with, because the journey you can get some hiccups during the journey. I had a good experience. So how it looks like, you do the test, you do this vaginal scan, and then they send you the medication at home.
Okay.
And you have to self-inject yourself in the lower abdomen for 5 to 6 days with 1 injection. And then you have another injection to complement. So you have 2 injections for other 5 to 6 days. So in total, you self-inject yourself for 10 to 12 days, depending.
Are they like subcutaneous injections?
They're like the
micropin,
diabetes,
like,
yeah,
yes,
the small one. Some clinics, they still use the big needle. So it's like...
yeah, it's the reason that I ask, because I was just wondering, because there's going to be people that are a bit squeamish about potentially injecting themselves.
Absolutely. So, like they're trying to give you the small needle. So I had the small needle, so it was not too bad. Obviously, like the first time you're like, am I really self-injecting myself? And I'm like, which, yeah, okay. But you go ahead and do it. During the time you self-inject yourself, you have to monitor that everything is okay. If you feel like you're exploding, that your ovaries are exploding, you should go immediately to the clinic, because there's still a risk of what's called ovarian hyperstimulation.
Okay.
And that's not good. So if you feel like that your ovaries are almost exploding, you have to go immediately to emergency, because that's very risky.
Okay, is that to do with obviously the medication? What is
The medication? So they stimulate. You get stimulated too much. I can tell you that I've never seen this happening.
Okay.
At the time we created Amilis, it's very rare. And this country now, all the doctors are very, very attentive at the level of medication they give you. They even tell you in advance, look, we take this very seriously. So I'd rather have you to do the cycle another times and get more egg than go through this risk.
Yeah.
So they're very clear. And also now there's a lot of studies on the level of medications you take. So, like I've never seen this in 2 years that I'm at Amilis, thankfully. But there's a risk, and they'll tell you immediately just to make sure you're aware. Then, like you have a vaginal scan in the time, maybe there is some blood test to check that everything is going all right with you. The last day, you have to take a trigger shot, which basically prevents the eggs from leaving.
Okay.
Because you want them, the ovaries, because you want to be there when they go in with the needle. After 36 hours, you go to the clinic. They put half anesthesia. And then basically with the needle, they suck out the egg. They put them on a dish. When you sober up from the anesthesia, they tell you how many eggs were suitable to be frozen. And then you can store them for 55 years. The process is like having your period for around 2 weeks.
Okay.
So it's not fun. I mean, for me, in my personal experience, I felt uncomfortable. I felt bloated. I didn't take time off. But I did the retrieval on a Friday. So I had Saturday and Sunday to recover. But Monday I was back to do my thing. It's recommended that if you can take 1-2 days off, if you do it on Monday, maybe you want to have Tuesday and Wednesday to chill, to see how it goes. You can obviously foresee if you will be uncomfortable or not. But if you can take 1-2 days off or work from home, now we have this thing that you can work from home. So, you can do this from the couch if you want to. I don't see any, unless you're very sick, so then you have to take some time off. But again, I've seen this less and less. That they control the medication quite well. It's a treatment that is done. They do it a lot every day, so it's getting better and better and better and better with every day.
Yeah. Are there any particular challenges that someone might face? You mentioned your other co-founder, and conditions like endometriosis, polycystic ovaries, things like that. Are there any challenges that those conditions present with potentially freezing your eggs, or things that maybe someone should consider if they are aware that they have those?
Yes. So polycystic ovaries doesn't prevent from doing egg freezing, but doctors say that that women that have polycystic ovary might take a little bit more time to get pregnant. So if you have been diagnosed with polycystic ovaries, which by the way you can see from an AMH test, I believe that 90% of the doctor in this country use now AMH tests for diagnosed PCOS.
Okay.
So it's that's why I'm saying, we're very big advocates for every woman to go and test, because you can understand a lot.
How much is the AMH test?
With us is 80 quid.
Okay. So
it's quite affordable.
Affordable and accessible, and something that, as you say, takes no time at all and will give you very clear insight straight away that whether or not this is something that you can
100%.
start.
100%. And it's just gives you also like an idea. For example, we had a patient some months ago that did a test. She was in her mid-20s, I think like 25 or 26, and she discovered that she's perimenopausal because her MH level was very low.
Oh, goodness.
Yeah. So, if you see this when you're in your mid-20s, you can take action, right? So that's like the positive is that that in your mid-30s, most likely you'll go to menopause. So you can take actions, like we can redirect women to what's your next step, like maybe you should, instead of freezing eggs, maybe freeze embryos. Or, like if you have a partner, have a serious conversation with your partner, like, hey, I might hit menopause when I'm in my mid-30s. I need to get my chances to have a child if I really want to now. I don't know. Like, so you put things in perspective if you know earlier, right? So that's why we're big advocate of every woman go and do an AMH test.
Yeah, I mean, forewarned is forearmed, and it seems like this is a pretty standard procedure that should really be offered pretty much unilaterally to everyone straight off the bat. If you're thinking about having a family or anything like that, this is something that you should be offered.
100%. And we have an event now that is going very well. It's called Fertility and Fajitas. So every month, like F and F, like, it gives you like a little bit of, obviously we're trying to keep it happy as much as we can. But essentially, we have partnered with a lab in the UK, actually 2 labs, one in London, one specifically in London, and one all around the UK. And what's happening is that we have seen that actually women come to the lab and test, and they are happy to, like ask questions when you are there, or see women that are going for the same test and have a fajitas. Like to feel like, okay, I'm going to test is not like we're destigmatizing also, like I'm going and test for whatever reason you're testing. Yeah. We see that some of our women are trying to conceive, or some women, they just want to understand, like where they are fertility levels. Maybe egg freezing is not even at the back of their mind. They just want to test because they heard from a friend, oh, that's a good test. I learned XYZ, So like for us, this is a huge win, because if you learn XYZ, happy days.
100%.
So we do this event now, and we see that we always sold out, which is, which is a great news, because it means like, okay, there's people are keen, women are keen to understand where they are in their fertility level, and we make it very affordable. So, like, it's like coming, meeting other women, mingling around. So happy days. It's like, it's good. Like we've seen that this is working very well. And my guess is because you really want to, like nowadays, women really want to understand, hey, what's going on with my body? Like some of the women, they come and test, they have very heavy periods, and maybe they want to test their hormones as well. So there's a lot of factors, like that we see nowadays on women's and hormones and condition, as because endometriosis is another big condition. Unfortunately, it's not always clear because it takes a lot of years to get diagnosed. You can, like, there are a few points, like I have heavy periods. My period is not, is stopping me from having a good life. So there are a few factors that you could be alert and think about, oh, this could be endometriosis. We work with specialists at Amilis that, like are more, that have seen endometriosis. Ultimately, endometriosis, it can be mild, moderate, or severe. So in some cases, doctor probably would recommend you have to remove the endometriosis before freezing eggs. So that's something also that needs to be considered. But eventually, like endometriosis is a big condition that we see in a lot, and it's quite painful, unfortunately, for women that have it. And, I mentioned perimenopause. It's something that we see in a lot. Now we do, with the women that come through our events, and they do also hormone tests. Some see that they have thyroid imbalances. So, like there are a lot of, with a simple blood test, you can see a lot of conditions, and you can make conscious decision on your next step. Yeah. Endometriosis, unfortunately, there's, you have to, nowadays, there are just very few ways you can detect it, and it takes a long time because it's a very still underdiagnosed and understudied condition. Unfortunately,
I think it still stands at about 11 years on average for a diagnosis. And then, as you say, you have to have a laparoscopy to remove. So it is a very big challenge.
It's a big challenge.
With regards to the knowledge gap that you see very often when you have these events or you talk to women in general, what are some of the biggest gaps in knowledge that you so often see when women come in to talk to you?
So it's interesting because the first question that we always receive is like, what should be my result? What should my AMH, what's the result I'm hoping to have? And there's not an answer to this question. Unfortunately, it's like it depends. It depends, of course, on the age. It depends if you have been diagnosed before a condition. It depends from a lot of different things. So there's no result. It's like, and every single person is different. So you can have a range in mind, but again, even with the range in mind, we can't foresee the future if you want to go ahead and freeze or how many eggs you're gonna freeze. So the first question we received is like, what's my ideal range should be? What's the number? There's no answer to this question. And then we have also like, the last few events, there was this lady was trying to conceive, and I was like, okay, if you, the NHS says if you're trying to conceive for 2 years and it's not happening, then you go ahead and see a specialist, or you consider IVF, you can go test more. And I was like, but how many years are you trying to conceive? I'm like, oh, no, just a month or 2, but it didn't happen last month. Okay.
There's a little bit more time that needs to be invested in
and
there.
Like, it takes on average 1 year to get pregnant, so I think you can, like, just keep going, like in your process, like it's also fun.
I was going to say, it's not the most unenjoyable.
Exactly, But I understand, because like it hits, like if you really want to, and like, I'm like, oh, this month didn't happen. And then I'm trying to, it doesn't happen. I'm like, oh my God, you start making movies in your mind. But I'm like, don't worry.
Which stress actually is another factor that contributes to that. So that is something that, the whole negative cycle.
And then I'm like, when you're fertile, like, because it's not like that you're fertile all the 30 days of your month. So I'm like, oh, really? I'm like, yes. So,
wow.
That's big an awareness too.
Okay, so even understanding the kind of like the different phases of your period, understanding when you're going to be at your most fertile, when you're not going to be fertile. Okay, that's really
interesting. Yeah, like we live in this bubble that you get just, you see Hollywood movies. Oh yeah, let's get pregnant, and I'm getting pregnant tomorrow. It's not really. Yeah, it doesn't really work like this. So like this, I've seen it a few times. I'm like, because I'm like, do you know when you should have action, right? Like it's like, I mean, whenever you want, but you're fertile, not
the window is very small.
The window is small, so like get your chances during those 48 hours. Oh, really? I'm like, yes. And like nowadays there are millions of tracking apps too that you can, or the Ring. There's a lot of things, but like this is something that I see a lot. The AMH level, or in general, like women just want to understand how is their like egg freezing. Like some of them, they come just as a first step, but they're not sure yet, so they take other months to decide and plan. So this is something that we see a lot. We have seen some patients that's a bit more that was a bit more touchy, that like have been diagnosed with cancer, and they had probably to proceed to go ahead and freeze their eggs very quickly, and there were not availability for the NHS, so they decided just to go privately. So that's something that we've seen too, and obviously like we've seen also some patients that they didn't, and they just went ahead with the chemo, and that, like now they don't know if they can conceive anymore or not, so they come and test. So, like this is a bit more on the touchy side, but we have seen this too. So we've seen a lot of, but in general, the question we receive is always like what my AMH should be, like, or women that are trying to conceive, and, maybe they should read a little bit more, like when is the best time. And these factors. We receive sometimes also question about the partner's sperm quality, how they can test, is there a test, or all these sort of things. So, like testing is becoming way more popular.
Yeah, I think that's a really important thing as well. I think a lot of the time it seems like at least more common for the woman to go and get checked out and tested first, whereas actually, there's 2 parties in this, and the guy can equally go and get that test very, very early on as well. And that actually also has benefit doing it earlier as well. If you're thinking about having a family as a man, you should be checking your sperm quality and things like that earlier rather than later.
100%.
Because, there are certain conditions that become more likely for the child potentially the later that you decide to have kids. Speaking of lifestyle factors and things like that, are there any things that anyone should kind of like consider Should they make tweaks somewhere before all this sort of stuff to give themselves like the best chance, the healthiest chance to maintain their egg health for longer?
Yeah. So I'm not a doctor, but I hear this on daily basis. So I'm just gonna repeat what my doctor says all the time. Also, when we ask them, when we actually did a great video with Dr. Vivian Hall that you will be able to see on Amilis, and we ask her these specific questions because we receive a lot. Can I vape when I'm doing fertility treatments, or is vaping affecting my fertility, or smoking, or I don't know, sugar, or like all these sort of things. So what we've seen is that if you go to a fertility specialist, the first thing most likely they will say, like, do you smoke? Smoke is being seen that it's something that does affect a person's fertility, both men and women. So cutting on smoke is probably a good idea, not just if you're freezing your eggs, but in general, if you're trying to conceive, both men and women, smoking is lethal. Another thing that it's probably the doctor will suggest is whatever makes you feel good, just do it. So there's no evidence that, like if I eat one food or rather another food, there's no medical evidence, it's not even, I've been checking on this. It's not there's no medical evidence. Nobody did a study on it. So if nobody did a study, of course, there's no medical evidence. But, obviously they need to back up their with research and, like on papers that have been, written and tested on patients and, clinically trialed. So, if not, they wouldn't recommend it. So there's no paper that shows that if I eat a Mediterranean diet rather than a Middle Eastern diet, for example, I will have a better, more chances to conceive or a better outcome to my egg freezing. So diet, it's always a question mark. I think it's sensible that I'm not going to eat 3,000 grams of sugar on a daily basis if I'm trying to conceive and be healthy, because it doesn't make sense. Yeah. So I'll try to be as healthy as I can, probably cut on alcohol, something that we'll recommend, keep the alcohol consumption as minimal, do the exercise, stay calm. Stress is big. So whatever, like they would say, like calm, like if you're a stressful person and you go and run a marathon, calms you down, go and run a marathon.
Okay.
So, like they will say, keep the stress down. Diet is always a question mark, and for sure they will say about smoking. So these are the things that we always see, but also stress is one of the biggest factor that affect that goes ahead and affects fertility or the outcome of a treatment.
Yeah, it's moderation. Just being sensible and actually not having to over-engineer things. Stress being a big one, I think. Again, comes back to that conversation that we had with that lady who's, 1 month in, and actually she's stressing out about, it hasn't happened. What does it mean? Well, it doesn't mean that much. After a little while longer, maybe you want to start thinking about things. Maybe a little while longer after that, okay, cool, then let's start looking at things. But limiting those factors seems to be, pretty sensible. What have you heard from other women? What have you experienced when you talk to them about what you're doing and how you're trying to approach things? What's the response like? How do they engage with that?
Yeah, so there are two responses. One is like, oh my God, this is so cool. Thank you for doing this. I wish I had this Amilis when I was going from my egg freezing or discovering my fertility, or, like, this is like amazing. Awareness is important. So like there's very positive feedback, and there's a lot of also because I'm a woman, and obviously I'm a woman. I'm a woman. My co-founder is a woman, and like we're going through things because we have ovaries, and
again, relatable, right?
Relatable, exactly. So like we are women feel sometimes empowered of me sharing my journey or my co-founder sharing her story. So like it's like we decided that we will share like as much as we can. I have a baby now too, so like I'm sharing also my journey throughout pregnancy, postpartum, maternity, which is a bit outside of the company, but because I'm a woman, I always do. And, like, I feel like that women really, founders also that have kids and they went through this, it just resonates with them too. So we receive a lot of empathy and positivity and stuff. On the other hand, we also have people that for their own whatever they behave, they are not very happy with egg freezing. They think it's unethical, or they think, God will let them have a kid or not. I don't know how to put this, but like,
they think it's we're playing God, that we should maybe be a little bit more kind of just let nature take its course type thing.
Exactly. Let nature take its course. Exactly. Let nature take its course. And, yeah, exactly. Or why some people, like, we received a comment the other day through our fertility and fajitas events. Somebody said, I can't believe you are selling AMH tests. Don't go to these events. You can have a free test by the NHS, which is not true. You can't have a free test from the NHS with AMH. You can have a free test from the NHS if you have a partner and you've been trying to conceive for over, I don't remember if it's more than 1 year or even 2 years. Then you can go through the path of the NHS to do all the infertility investigation. If you're a single woman and you are in your early 30s, the NHS is not going to give you an AMH test. Like, that's how things are. And
you either have 2 years of pain with your partner that you're trying, or nothing at all.
Or nothing at all. So, like, but, like, what concerns me is that you can't, like, you shouldn't write something like the NHS, something like this, like, do your research. And also, like, don't put this, also, like, the NHS has a lot of stuff going on, like, don't have a overload of women going, oh yeah, I want a free test from the NHS, like, because there are people that need it more than you, and they should have the priority if that's the number of tests the NHS can offer per year. So, like, there's, like, in my mind, I was like, maybe there are people that really need it more than you. You can spend probably £80 or whatever it is to do an AMH test, and there are people that really need it.
I've had this conversation previously with a guy called Tim Murdoch. He is someone who works at the Cambridge Design Partnership. And we spoke about the social contract that exists that really goes unacknowledged with the NHS, which is, if I'm someone that has the means to pay for a test, an AMH test, for the £80, then I should pay for that so that someone who needs it more can get access to that. Equally, in terms of keeping myself relatively fit and healthy and not doing silly things that are going to mean that later on down the line I'm going to need a whole load of those resources. That social contract needs to be acknowledged and respected by people. And I totally agree with you that, rather than waiting that 2 years, if you can spend £80 to get that test result and not burden the NHS with that need, do it.
Exactly. That's, like, that was my thought when I saw this. But also in general, like the women that we see come in and test, they are, most of them, I think, like, I can give you a percentage, 74% of them, they're single. So also saying that, like, put them in a perspective, oh, I can have a free test in the NHS, and probably they go and they ask for his GP, and we're like, no, you have a partner, you're trying to conceive, and there will be no. They have expectations that are not met. So, like, they're also, like, when we see, like, a patient journey from an Amilis point of view, when the expectation of the patients are not met, then we have an unhappy patients and, like, all these sort of things. But when, like, you know what to expect, we have rarely seen this. Yeah. So, like, in general, like, the patients that goes through a journey with acknowledgement, and that's what we're trying to do as much as we can, it has always, like, a positive outcome. Like, what to expect. So, like, sometimes we've seen this with egg freezing. If the doctor tells you, oh, yes, you can freeze 15 eggs, happy days, and then you go and you freeze 3 eggs, that's not setting expectation right? So, like that, but we've seen this. That's also why we partner with some clinics rather than other, because we've seen that, like, meeting expectations of the patient is very important. So this is to say that positive. A lot of people have a lot of positive things to say. Some other are against fertility treatment, egg freezing, or in general, like they just want nature to do their course. So they're very judgmental about it. We've seen a lot of like culture, religion plays a part in it. So we've seen this. We actually, and I have to say this, we have applied for a governmental grant, and which we didn't get. It was Innovate UK. We didn't get the SMART grant. And one of the assessor was very against anything related to fertility treatments or whatever. And it was very clear. And one of his or her comment, I don't know, at the end of the grant was like, I'm very concerned that the UK will end up being like Japan, because in some area of Japan, as soon as you, like, they're putting a law, I don't know if they put it or not, don't quote me on this, but I've read that they're offering free treatment to egg freezing, almost compulsory for some women, because there's zero nativity. So as soon as you turn 30, they will be like, freeze your eggs. In some areas of Japan, there's zero nativity.
Okay.
So what the assessor was like, I'm very concerned that the UK will be like Japan, and we will force women to go ahead and freeze their eggs, and this is very unethical. So something in this way. So, we receive all the sort of comments. I'm happy to take any sort of comments. Eventually, people have the right to believe and think whatever they want. Ultimately, something that I do not want to happen is that we cut options for others.
But that's what it seems like to me.
Exactly.
It seems very short-sighted, and we know that there is a declining birth rate in the West. The UK, America, Europe. We're seeing birth rates fall because of the expense that it costs to have children now. And to cut down a woman's options, to not be able to provide her with the opportunity to build her career and potentially still allow herself the opportunity through technology, which should be available to everyone, to have that option is fundamentally, if you want to talk about playing God, as far as I'm concerned, then you are playing God by, that makes me quite angry, because you are playing God with someone else's life and their ability to have their own agency, their own choices, the ability to do something with their health and their future possibility of a family. You just remove that from them. It's unacceptable.
I completely agree with you. It's just, when we say your freedom stops when my freedom starts. So, this is something that, for example, you can see egg freezing or IVF or in general fertility treatment, unethical for whichever reason. It's not for you. Okay, let's not crucify people that, they want to go ahead and do fertility treatment, or just, the states were now voting in some, to make a fertility treatment not what they were doing, voting for not having fertility treatments available or whatever.
Unfortunately, there's some stuff in this this Plan 25 document that I've been spoken to a friend of mine about, and she was actually over in New York recently to talk to some people about that, and with the work that she's doing. And genuinely, it's terrifying in terms of what it's proposing, in how that limits women, with safety as well, with choices that will be able to access things like contraception and stuff like that. That is bananas that we are living in that time.
That's medieval.
It is medieval. We're living in a time of supposedly enlightenment and education and technology and innovation. What the heck is going? In that regard, I do not understand. Yeah. It just blows it blows my mind. With that kind of point being made, are there some of these stories that kind of stick with you more than others? Is there something that particularly stands out that kind of continues to drive you forward with the work that you're doing?
Yes, of course. So there's I actually want to share that, as mentioned to you before, we are fundraising. And, we did around last year of fundraising, and I did it pregnant. It went very well. Obviously we received millions of no's, but then we received a lot of yes at the end. It's barely to get one yes, and then everybody says a yes. So was good.
Snowball.
So exactly. So now we're doing the same. And, we're at the point that we receive a lot of no's. And the other day I was like, I'm not going to do this anymore. I can get like a very, very high paid job. Like I used to be very well paid when I used to work in a big corporate, was working very little hours. I reached a good point in my career. And then I woke up in the morning and look at my husband. I'm like, I'm going to quit. And I want to help women to navigate their fertility options. And, like now we're doing women's up. So all the sort of
It's
things.
a noble, if low-paid mission.
Exactly. So I was like, okay. And then take a salary for a bit. Then we fundraise. Now I have like very little salary, like in general. I'm like, okay. And the other day I was like, why am I doing this? Why am I doing this? I can literally go ahead and get a very big salary and be chill, like chill, like whatever. And then I'm like, no, okay. I'm like, I take a step back and I'm like, okay, whatever. If this guy said no, it doesn't mean that I'm going to receive a lot of other no's. They say you need 200 no's before you receive a yes when you do this. So I was like, what brings me back to keep doing this rather than just quit and get 6-figure salaries? And I was like, okay, And then I received the story of this girl that did the treatment with us, and she was very happy and stuff. And I go back to that place, and I'm like, okay, we have changed somebody's life today. And, like tomorrow it will be something else. And then, like I'll go back and, like I chat with some of our women, they go through it. I go to our events and I receive the energy from women that actually are curious and want to change and take ownership of their health. And, like then see like the work that we do, even if it's at this level, a group of small women and, tomorrow will be bigger and bigger. But seeing the impact of what we do brings me back to, I'm like, I'm going to fucking smash it.
Yeah.
And I'm like,
Love that.
We need more money. Like, just get money in, It's like, forget about your salary. Let's just keep going. So, like, going back to that place and seeing like that we change somebody's life in a positive way makes me happy.
Well, I think about that like ripples. Like, it's actually, when you say that, you're not just impacting that person's life. You impact 2 lives immediately if it's successful, because there's a baby involved in that as well. And then if she has a partner, that's 3 people's lives. And then there's all of the lives that baby will interact with on its journey through life. So actually, that one person that you impact, it has so much further ripple effects and consequences. And then you do that on scale with other. That's an incredible mission to come back to. And it really, really speaks to, where your moral compass is in terms of, as you say, you could take the corporate job, but there's something that's driving you more, that's actually more meaningful. Yeah. With speaking about guys in this conversation, is there a knowledge gap with men where they can upskill themselves, things that they should be aware of, and any way that they can get involved in this area that's helpful?
Yeah, so we have seen a recent study, actually a study, it's not very recent, that has seen a very decline drastically quality of sperm. I don't want to like if I remember the statistic right, it was like 50% in the past 50 years. So it's quite big.
Every generation, it seems, with every generation, the fertility level of men is going down catastrophically. Yeah.
So, and this is due mainly to lifestyle.
They're talking. There's stuff about like microplastics and all that sort of stuff.
Yeah.
But yeah, it is a big topic at the moment.
It is a big topic. So we have we're not working with men. We don't have this in the pipeline, but we have seen some men actually. They came through Amilis and went ahead and freeze the sperm. We have few actually. So we have seen, then we spoke with them what the reasoning, and some of them they were going for cancer treatment.
Okay.
So which is something, for example, that they knew because they had a very good doctor that direct them through it. We know that very little men before going for cancer treatment go ahead and freeze the sperm. So this is something that is an awareness problem, and we should raise a lot of awareness on this, because like it's like even women probably I don't know which sort of cancer they've been diagnosed with, but like every woman should go ahead and freeze eventually if they go through cancer treatment. and men the same. So, like now we're speaking about women and we have a bit more awareness about women, but the men really, there's zero awareness on men on this topic. Because also we live in a society that we think, like men are always fertile, like at any age they can conceive and all of that.
Well, Al Pacino, I mean, he...
Exactly, So but actually also this is a big lie, because I know that sperm regenerate at 3 months. So men, in contrast to women, like our fertility declines with the years, men can regenerate the sperm on average 3 months. So you can improve the quality.
Yes.
The point is that you can improve the quality on every 3 months, which is good news. But eventually there's a lot of sperm tests. Actually, Jack Fertility is doing this test now for men that you can just do it through the post. There are also other tests, like that you can do. You go to a fertility clinic and check your sperm too. The sperm needs to have as 3 main components. So, like after that they check these 3 main components, they will be able to tell you, if you have good quality sperm or not. If it's a no, there's ways you can regenerate your sperm. We actually had a session for San Valentine, and we invited an andrologist that works in one of our clinics. And he was really like speaking about like sperm quality and what affects it. There are some jobs that really a man does that affect the sperm quality,
Really?
like cooking, being too close to heat.
Yes.
He was saying that.
I also remember thinking about reading about this with sauna. They say
Sauna.
if you're thinking about conceiving, don't go to a sauna too often. That has an impact. Yeah, heat is a big one.
When you bike, the scrotum gets closer to the body, and it needs to stay. The temperature needs to be lower, so the sperm needs to be at a lower temperature of the rest of the body. So it needs to be less than 36 degrees.
Okay.
So there's a lot of factors that we learned through that session, with Dr. Ted. He went through a lot of things. Even men that work in with chemicals does affect sperm. So if you with painting, or there was a guy that was in a studio all day with radio frequency, all these sort of things, it does affect. So there's a lot of things that we don't know it affects. We're gonna do another session maybe with
well,
Dr. Ted.
Let's grab some links as well. We'll put those in the show notes and check that out for sure, because it sounds like, again, another massive awareness piece for men.
Massive awareness piece.
Because I've never heard anything about, kind of, as you mentioned, about the cancer side of things. If you get a diagnosis, consider, freezing your sperm so that, if you go through radiotherapy, if you go through chemotherapy, the quality can be preserved from your previous sample, as opposed to what will obviously be potentially affected.
Yeah, so that's very important actually, because again, the rest, you can, the sperm can improve in quality. I know that, for example, there's also a very common condition, as much as PCOS for women, which is, I forgot the name, but it will come in a second. And it's very common in between men. Basically, it's and then there's a little surgery that basically they go through the neck, they ping here, and then your sperm is back to fertile. Because apparently you can still ejaculate, but there's no fertile sperm in.
Oh my goodness! Yeah. Wow.
It's called. Oh my God, I forgot the name. I'll think about it, but it's very popular. 1 in 6 men has it.
Okay, well, we're definitely going to need to again figure out the name and put that in the show notes as well, and make sure that we can kind of link to some resources for that. Slightly spicy question.
Yeah.
Given the state of the dating market at the moment, and I'm asking this from a person who's got lots of single friends.
Yeah.
Do you think we're going to see more people, or more women specifically, freezing their eggs?
Well, that's what we hear. I can tell you that 82% of women coming to Amilis and looking at egg freezing, they're single.
Wow.
So it's a big number. And they all say that the dating situation, dating app, and, all this is not the best.
Mm-hmm.
So I guess also looking from the trends, egg freezing is having a huge spike up every year to year. Is the treatment that has 60% growth in 2 years.
Wow.
So it's like on average 28% growth per year, which is humongous. Year over year, it's like the highest paid out of the pocket treatment in the world. So it's a big deal, and this is due to obviously. I mean, there's a lot of factors. Obviously, like there's some also like some women at birth that change gender, so they go through egg freezing, or like not just single. I did it when I was in a relationship, but like we didn't know when we wanted to have a baby, so I just freeze. Now I have a baby. We got her naturally, but in the future, I'm not getting any younger either. Actually, my birthday was yesterday.
Oh, happy birthday! Goodness.
Thanks. So like if I want like 2 kids or 3 kids, I don't know when I'm gonna have the next one. So I might need to use my eggs. So like if it's it could be an additional option. And I think it's not a good market. Yeah.
Well, yeah. I mean, from what I've heard from a lot of my my female friends, it's not a good market. But I think the key thing here is just giving the option, right? Being able to have the option, and the education part is so massive in this, knowing that it's better to do it earlier, that there's a £80 blood test that will basically give you a very strong indicator as to kind of your fertility levels and where you are. Basically knowing the ins and outs of the process that will come off the back of that. Just having that education empowers you to make a decision so that you can make a choice that will preserve your options later. It might not be something that you want to do right now, but there's something that actually can be done later. And I think that also, with that education, coming back to that societal point, I think that puts potentially more pressure, upward pressure, towards legislators and government and policymakers to say, actually, this should be something that we are considering. We're seeing that more women are doing this, more women want this. We have these declining birth rates and statistics. This is something that we need to actually start putting some public funding to, because at the moment it seems like it's prohibitive for women to have this option. Speaking about money, I know that we're here to talk about Amilis and your experience with that. I want to touch on your experience as a female founder who's also raising money. What has that experience been like? Obviously, I've heard you speak previously at a meeting where we actually got the chance to meet. What's that experience been like for you? Give us a little bit of a flavor on that.
Yeah. So in one word, pretty shitty. But I'm going to articulate better. So we did raise a round last year. It was our pre-seed round, which get things going. Like we validated an MVP, and we had tractions, we had clinic on boards, doctor on boards, we had patients. So, like things were going well. And we managed to close a pre-seed round. It was from Angels and led by a VC that is based in London. It's called Ascension. They were the lead investor of our pre-seed round. So with that said, I mentioned to you that I did this pregnant. So it was like intense. I'm, it's like you're a bit more emotional during pregnancy, but I was like, this needs to be done now so we can chill. And I remember even the week before I actually gave birth, I was sending out, the round was closed and everything went well and everything. But the week before, I sent out the shares papers to all of our investors. I remember doing this, and I was like, okay, like I should chill by now. Like I'm 9 months pregnant. I gave birth in Spain, 43-degree heat waves. I'm like, I should chill by now. So it's just never ending. Happy days. Now we're raising another round, seed round. So I don't know, like because I truly believe it's because we are women, both me and my co-founder. Sometimes we just get questioned for no reason, because I see that other guys, they just raise money so easy. So my thing is that our men are better bullshitter than women, or is like, because we have all the numbers, we're everything, like all the what is called metrics For VCs or for investor, we have, okay? And then we still receive like, I'm unsure about this, I'm unsure about that, blah, 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 you know, like whatever, you know, like, or like, I'm unsure about what. Sometimes we receive email that do not even make sense in English. You know, English is not my first language, but I will double check that my email makes sense. Or, you know, like it was like, guys, I just don't want to invest in this company. Fine.
Yeah.
You know, like, fine. You want to focus on something else? I understand. But like saying, I'm not sure about this.
It would be like the equivalent of saying, I don't believe that this is a growth market.
Exactly.
When you see 82% of the people walking through your doors are single women, when you see the amount of interest that you've got, I mean, you'd have to be living in an alternate reality and not see that this is a massive growth market.
Exactly. You know, like, so in general, you know, like, even if you don't believe in our strategy, you're like, look, I can see a lot of potential in this market. You guys have already like contracts and everything in place. Like, let me help you with the strategy together or something, you know. But, you know, sometimes we just really push back, I don't know for what, like for no reason. So, you know, like sometimes I'm like, you know what, it's fine. I'm not even going to buy. Thank you for your time. Bye. You know, like it's just, I just wash it through and then I'm like, okay, next. You know, but that's, you know, like now I realize, you know, that's the life we picked. You know, like as I'm the CEO of the company, so I guess my job is like just wash it through. Next, next person, next VC or next family fund, whatever it is. So, you know, like I do believe because we are women that, you know, like we have received more pushbacks. And I'm unsure about it, like, because what I can say is that I do see that financial model made by men are way bigger than the financial model that women do. So now, like, that's what I'm saying, you know, like, maybe men are better at explaining numbers and showing number, which, by the way, is all bullshit. But, you know, like, they're better at this than us, so they get more traction and they get more people through the door. That's my assumption. You know, like, or, you know, like, there's just a bias. I'm not really sure about that. But we do receive a lot of pushback, or, you know, it's just, I don't know, like, maybe it's just a societal thing that we still don't see, like, a lot of women in that, you know, reach CEO level. So, you know, like, we're like, okay, a guy will do better. I don't know.
It's a really, really interesting area, this, because actually, to the numbers thing, you're right. A lot of the data points towards and this was from the panel that we heard as well, right? Male founders will often inflate the numbers to perhaps unrealistic numbers rather than actually being conservative and being like, this is the true size of it. And I suppose VCs, by their very nature, want the moonshoot. They want the unicorn that they perceive, as opposed to someone who's actually being realistic and saying, this is where great growth, huge potential, this is where you're going to get your return on investment. You're actually going to see, you're going to make money. You're not just going to give us a load of cash and then we're going to just burn it all and then nothing.
Yeah.
This is actually speaks to a point about female CEOs as well. Again, actually tend to be better in terms of forward planning, making sure that the money goes where it needs to go. And I have seen this firsthand from some of my friends who are female founders, you know, my friend Bianca, who actually has gotten her company to a self-sustaining point now, where if she does nothing, the company will be self-sustaining. She obviously wants to continue to innovate and to grow things, and I see this through other friends. So it does raise a really interesting point about, you know, just because you don't inflate those numbers or pump them up as much as they may be more attractive from the profit that you'll make, should not stop you investing. And actually, the moment that we're in right now with the financial situation around the globe, maybe a little more prudence in where we're forecasting would have been a better thing in the first place. So we could actually have not found ourselves where we've got these companies in tech especially that are way more highly valued than they really should be.
Yeah. I mean, I see this a lot. So yeah, that raised a good point with me on this. I know that eventually we're gonna get there, but you know, it's like it's a journey. Also, like, I do think one thing that men take rejection better than women. You know, like in this one, I have, you know, because I see it on my husband. You know, if somebody says no to me for whatever reason, I'm gonna be moody for a second. You know, like I'm gonna be moody. You know, and I'm very quick at just pushing away. He doesn't give a fuck. You know, like if somebody says no to him, he gets upset for like 5 minutes, and then he's like, okay, move, you know, something else. So, you know, like that makes me think there's something there, you know, like that I'm like, okay, whatever. You know, like say more, maybe it's a survival process. I don't know, that we kept through the centuries. I don't know. But, you know, like I think like men wash it out faster than, and we stay on it a little bit longer, which prevents us to be rational and lucid again. You know, like in a faster way. So like think like this, you know, like, and I'm trying to work on this a lot, because this is something that I can work on. You know, like I can just.
Well, actually, that was going to be my next question, in terms of how has that kind of shaped that rejection, the comments that really don't make any sense. How has that shaped your experience in terms of other parts, in terms of actually being a business leader, being a mum, being a female founder? How has that experience kind of helped you progress, or kind of like maybe make you see a way that you want to do things differently?
Yeah, so I learned one, like, also, like, I have a rule now on this. Like, I'm not taking shit from anybody anymore. So that's, like, my rule number one is this. From whatever I have, you know, in front, you know, like, I'm happy to be challenged. You can agree on what I'm doing. You cannot agree on what I'm doing. But, you know, like, I won't be silent on, you know, like, anything that, you know, the company is doing. We're doing something that has a lot of meaning and is changing lives. And we want to improve the status of medical research for women. So, you know, like that's like our mission on a long term is that we will cut down the endometriosis pathway to shorter years. We will help, you know, like the path to care in the future. So this is our mission, and I won't be silent about it. If somebody doesn't understand it, it's okay. But if they challenge me on this, I will push back as much as I can, you know. This is like for sure. If somebody challenged me on my personal state, like it happened in the past, because I have ovaries and I was able to conceive my kid, I will tell them to go to hell, you know, and it happened in the past, you know, and eventually I will have another kid if I can, you know, so like I'm very clear on this. On the other hand, you know, it's like I'm happy to get challenged on, you know, like if in a constructive way. You know, like I put myself in this position because also like I'm happy to receive constructive feedback. If we're doing something wrong, I would like one of our investor or the advisor to open my eyes. I'm like, hey, probably should consider something else. And it did happen recently, because me and my co-founder, we were very stuck on something. And we were not able to see that we were thinking too advanced. We were not there yet. And we jumped few steps that were immediate step we could take to improve the strategy and the go-to-market for us. And one of our advisor, actually an investor, one of our investors was like, guys, this is not the time you should do this. This you probably can do it in 2 years. You know, like now you should think about this and this and this. And it did open our eyes, and we did see we're missing steps here. And we did take a step back, and now we're back on track, you know, like now that's why we're growing faster, you know, like, so, you know, constructive feedback and opening my eyes, I'm happy to receive. Destructive feedback, you know, like I'm also like Italian and very fiery, you know, I work on this in my ears, but I'm very fiery. I will like, if somebody doesn't speak with me in a way that I think it deserves, that it's not nice, or that they're not being nice, or, you know, they structure their question in a disrespectful way. If I think they're being disrespectful, I will tell them to burn to hell. You know, like I have no problems with that. And I learned this is like, I'm like this, or you take it or you leave it. I have ovaries. One day I will have kid. As an investor, you know that. If you don't want to invest in ovaries, go up, it's fine. I want to have another kid. If I can, I will have another kid and I will be pregnant again. My co-founder, most likely she will have 3 kids. She wants to, so why not? If you're not happy with it, do not invest in our company. And ultimately, we ended up saying no to some investors at last round that they were like, we thought that they were not aligned with the companies or with us. And that's also something that, you know, if I encounter some other investor in the future that will make comments on pregnant women, I will definitely think, okay, this person, I don't want to engage with this person, because that's the status quo. So that's where I stand today, and I learned a lot in the past from like shitty experience and from good experience, and I will be true to who I am.
Yeah. What would you like to see happen in the round with this in the future, changing attitudes towards this? And actually, it seems like there needs to be a bit of a shift here towards viewing female founders who do want to have kids, not viewing that as a negative, actually viewing that as a kind of pretty, not inconsequential, because it does have consequences, obviously, but as a reason to remove off the table in terms of investing.
Yeah. So obviously, for example, when I was pregnant, I had a conversation with my co-founder. I'm like, how long can you hold the fort without me being around? And this is a fair conversation you should ask. But, it's just because maternity leave is not something in this country, or very much a lot. No, actually in Spain it is. A man can take up to 1 year off in Spain. So as much as a woman, So it's like, it's very fair. This country is not super fair on maternity leave. I've seen like the statues with the men.
Yes, that's recently.
That's very cool. That's how we should, challenge the government on this.
But also parental bonding, like the dad bonding with the baby is super, super important.
Very important. So, it's just because something it doesn't happen today for a man, it doesn't mean, that a man can take 6 months off if he's a founder. And, now maybe, we're like, let's say like same-sex couple, they have a baby. If there are two men, one of the two would need to take some time off more than the other, or equal time off, or there's going to be some sort of advantage society-wise and corporate-wise. So we need to look at this. If my husband was telling me I want to take 6 months off, I'd be like, okay, you can take 6 months off. Didn't happen. It took only 1, and then I ended up taking 2. But, maybe, but I had an okay birth, I had an okay pregnancy, so I was missing it, and I decided to go back. I told my co-founder I was taking 4 months off. So as part that you have a plan, but, now we're talking about 2 female founders. If my co-founder was, if I was a man and my co-founder would be like, I want to take 6 months off as a man because I want to be with my kid, I would be take 6 months off. It's something doesn't happen now. It doesn't have to be. We shouldn't accept that. Should normalize. I think it should be normalized that both men and women, if you want to take some time off because you have a kid, you should. It's a magical time. It's amazing. It's one of the best things in the world.
It's also one of the biggest times in terms of development, right? So you literally see day by day almost the changes in the way that your child is developing, and to not be able to get those opportunities to see that. There's parents that have missed their kids' first steps or the first kind of like noise. That's a real sadness. And it's simply because, and it goes so quickly. And it's simply because the financial pressure as it is, or the way that things are set up at the moment, deems it that can't happen, where it absolutely can happen. We just have to be more open and receptive to that conversation and being able to actually say, no, it's important for both parents to be able to spend time with their child.
Yeah, of course. But, I believe that, I've seen now, other female founders that, went for pregnancy and everything. You manage your time, that if you're a female founder, what you're going to go through, for example. You take a conscious step that, pregnancy can be easy or not. I had a good pregnancy. Some other women might not have a good pregnancy. Have a conversation with your team, if you have a team or your co-founder about it. They can hold the fort for a bit. It's not the company is not gonna die if you take 6 or 12 months off, whatever you need. It's everything is manageable. It takes a bit more organization. It's investors should chill. Maybe they can help out, actually. Yeah, here we go. Maybe an investor, we have a board, a person from Ascension that is that is an observer. Maybe they can step in, I'm it's not it's 6 months. And, it's a CEO or CTO, we yes, you want to always invest of them at the beginning until the company runs by itself. But, it's you don't have to be 24 hours checking on what people are doing, so like, let's chill.
Well, that is to the point about you having the investor that actually said, constructively, there's something that you should be perhaps re-looking at.
Yeah,
You've gone too far down. That is a constructive bit of feedback from an investor. What's next for Amilis? What's the next steps on your journey?
Yeah. So we are actually raising this round because we are expanding more into the women's health.
Mm-hmm.
So yes, we started as egg freezing, and we will always be the point of contact, the main point of contact for egg freezing. But like already moving to organize this event like Fertility and Fajitas and the AMH test, the physical AMH test, we have seen that there's a lot of appetite for hormone testing or AMH testing. So we're going to expand to more like hormonal testing. And what we always do now with this testing is that my co-founder's CTO, she builds analytics and tech and some machine learning that is powering the data, so we can read the data faster, and we can draft the next step based on medical research. So we will be able to triage women to other path of care if needed. Like I was saying, like endometriosis, from a vaginal scan, if we see like fibroids or other conditions, we can better triage care. So this is next for Amilis. We want to triage women's healthcare in a better way, thanks to AI. So this is our big mission for the next year. And it's like a normal step for us because, offering already like vaginal scan and tests and so on, it's a logical next step that we improve our tech to cover the entire journey.
That is exactly what we need right now. It's getting technology leveraged to a point where you can get someone in the right point of their patient pathway when they need it, not waiting an over long time just to get there. That is absolutely incredible. If people want to find out more, where should they go? How can they get in contact with you and Amilis?
So we have a website, is amilis.co.uk, but also we have an email that people can reach out to us, patients or anybody really, is team@amilis.co.uk. We're on social media, Instagram, Amilis Fertility, and TikTok, Amilis Official. I should know this.
We'll put a link in the show notes.
Amilis Official. Sorry, I don't have this. I'm a bit of a social media nerd. But yeah, like we have a team that is looking at messages all the time. So reach out, let us know what you think. Constructive feedback, also not destructive, please. But you can tell us if also again we spoke about it, if you agree or not with testing or not. We're happy to hear from anybody, really.
Amazing. And don't forget Fertility and Fajitas events.
Fertility and Fajitas event is like we have 2 in London in October. So we have the dates on our Instagram in the link in the bio. We have 2 events in London in October. Actually also one in Manchester.
Amazing.
Yeah, because we just expanded in Manchester. We have a clinic in Manchester now, 2 clinic in Manchester. One is does egg freezing specifically for women with very high AMH. So it costs less.
Okay, amazing.
It's a very good package, yeah.
And before we wrap up, if there's one thought that you could leave our audience with today, what would it be?
Take ownership of your fertility journey and your health. It's very important.
Incredible. Sarita, thank you so much. This has been an amazing conversation. I've really, really enjoyed it. And I highly encourage everyone to go and check out what you guys are up to.
Thank you very much.